There are many. A few years ago, really, it boiled down to just two, either surgery or radiotherapy to treat the prostate cancer. Now it's evolved into many different types of treatment. Fundamentally, we have to decide, do we want to treat the whole prostate or do we want to treat parts of the prostate? If we want to treat the whole prostate, surgical removal of the prostate has been the mainstay of treatment for many, many years. That used to be done by an open approach, that is making an incision, but now that's evolved to doing keyhole surgery using computer assistance known as robotic surgery. The other main form of treatment is radiotherapy, and there are various forms of radiotherapy, such as putting seeds into the prostate and treating the prostate from the outside, known as external beam, and radiotherapy is also advanced in many years too. In recent times, we've learned that we can just treat parts of the prostate, so treatments such as focal therapy or partial ablation, which means we just treat the area with a cancer plus a margin around it, and we leave the rest of the prostate untouched. Such tissue-preserving therapy, as it's called, is really attractive to many men because it keeps many of those functions that men find important, such as erections and bladder control, completely untouched in many cases. So there are many, many types of treatment. And in fact, sometimes no treatment is required at all, and that's called active surveillance if you're young, or watchful waiting if you're much older. So there are many forms of treatment, as I say, and the world has many choices now to choose from. When it comes to deciding what form of treatment, it can be quite difficult or challenging sometimes to decide. There are many things to consider. So perhaps first and foremost is how old you are, what's your life expectancy. If you have many years ahead of you, you want a treatment or management strategy that's hopefully going to keep you alive and keep your life expectancy as much as possible. Then you need to consider what type of disease do you have? Do you have significant disease that's really needs very strong treatment, or is it relatively mild or moderate disease that can perhaps be treated by softer or easier methods? We also need to consider where is the cancer located? Is it located in just part of the prostate, in which case then you can have focal therapy or partial ablation, or is it throughout the prostate gland? Do you need to have treatment for the whole prostate itself? Then there are other things to consider too. What's your erections like? If your erections are very good and you want to preserve them, then you want to treat them and hopefully minimize the chance of that. And there are various forms of surgery that can do that. There's nerve sparing, sparing prostatectomy. There are also other forms of treatment such as radiotherapy, which involves seeds, called brachytherapy, which have good outcomes in terms of keeping erections. And then there are newer forms of treatment where we just treat a small part or small area of the prostate gland where the cancer is located, such as focal therapy with HIFU or electroporation, or in some cases for cancer at the front of the prostate, something called cryotherapy. Then again, there are also people who have problems passing urine. So some men are diagnosed with prostate cancer with significant difficulty passing urine, many urinary symptoms, and have a big prostate and possibly have a catheter in because they can't pass urine at all. In those situations, often an operation is the best way to go ahead because the operation will help you pass urine and will treat the cancer at the same time. So there are many things to consider, and to help make that decision, you really need to go to an expert who spent many years hopefully helping men go through those challenging treatment choices to find the best management strategy for them. With cancer, often you need more than one treatment, and that's very important when you think about the type of treatment you're going to start off with. So the answer is yes, you can combine treatment. So if you start off with one treatment, you might follow it with another. So for men with early localized prostate cancer, if they have surgery to remove the prostate, which is in many cases the mainstay of treatment, you can follow that by radiotherapy. So surgery obviously means removal of the prostate, the cancer's out, but sometimes there's cancer in other parts of the pelvis which have not been, which were not identifiable before the surgery was performed. In those cases, you can have what's called salvage radiotherapy to the pelvis. Sometimes this cancer is more spread out through the body, in which case you might need hormones as well. If you choose a focal therapy or partial ablation approach by HIFU, for example, in order to try and preserve erections and bladder control as much as possible, in some cases you get cancer persistence, or we get cancer recurrence in another part of the prostate. That doesn't happen frequently, it happens relatively infrequently. But if it does happen, you can follow that by surgery to remove the prostate or radiotherapy. The surgery may be a little bit more difficult to remove the prostate, but it still can be done, and it still works very effectively. If you have radiotherapy first as a treatment, then then that's a bit more difficult to follow by other treatments such as surgery or radiotherapy. After radiotherapy, the tissues around the prostate get very more difficult to operate on. So removal of the prostate it can be quite challenging and lead to more complications. Sometimes after radiotherapy, you can have treatment by HIFU or some other technologies, but again, these are more difficult. So yes, you can combine treatments, but often if you think you might want to combine treatments or if you want to keep as many options available to you as possible, it's often best to start off with a surgical approach or partial ablation with HIFU or similar technology, and then follow that on with some other treatment if needed going forward. Each treatment has different types of outcomes and side effects. So after keyhole surgery or robotic surgery to remove the prostate, if it's done with nerve sparing and if it's done in a way to try to maximize cancer removal, but at the same time preserve bladder control and erections, you can expect to have a catheter in for a few days or a week after surgery, sometimes longer. When the catheter comes out, you can you'll have some issues sometimes with bladder control, but usually those are temporary for most men and will settle down. Erections take a bit longer to recover. And usually the good news after surgery is that the way we monitor the cancer, which is by measuring the PSA, often that drops to unrecordable levels. And that's really good if that happens. And we know that with cancer removal by surgery, there should be no more PSA left behind. So it's reliable as a cancer treatment because what you take out cannot come back. If there's cancer in another part of the body that we don't know about at the time of surgery, then the PSA can sometimes be a bit higher. And then that can help us decide if someone needs more treatment. After radiotherapy, typical radiotherapy, that's usually a daily treatment for several weeks, sometimes 5 or 6 weeks, sometimes shorter depending on the technique. You can get some bowel irritation, so diarrhea, sometimes bloody diarrhea, sometimes some bladder symptoms, so going to the toilet frequently, so urgently, sometimes bloody urine. But generally those symptoms settle down after a period of time has passed after the radiotherapy. Certainly after surgery, we get side effects temporarily, but they get better. After radiotherapy, you can get bowel symptoms, and to some extent you can minimize those with some of the newer interventions, such as putting a spacer, that's a gel between the rectum and the prostate. And when you do that, that increases the distance between the prostate and the rectum, so you get less rectal side effects, less bowel side effects. So that's a recent innovation, which is quite helpful. If you choose a focal therapy or partial ablation approach, then actually there's very few symptoms after. So the chances of getting urinary leakage or erectile problems is much less than compared to the standard treatments. We know that after HIFU, for example, it's done as a day case. You go home and usually people are back in action or back at work within a week or so with very few residual side effects. And so that's a very well tolerated treatment. Similarly, there are some other treatments, some other radiotherapy treatments which are well tolerated, such as brachytherapy too. That can be an effective treatment, although sometimes some men get problems passing urine afterwards, and depending on some issues beforehand. So usually speaking, after treatment for prostate cancer, the recovery is relatively quick. There are not that many side effects, but if they are, they're usually tend to improve quite quickly, and we can usually, in most cases, identify which men are likely to have problems beforehand, and we can pick up the men who are going to do very well with each treatment. The prognosis after treatments for prostate cancer vary. So if you have treatment to the whole prostate, such as surgery, providing the cancer is confined to the prostate gland, the prognosis is very good. The chance of disease recurrence is really low. So you'd expect when you measure the PSA at 3 months, 6 months, and thereafter, that the PSA level would be extremely low or unrecordable. Occasionally, the PSA goes up, and that can mean there's cancer somewhere else in the body that needs treatment, or somewhere else in the pelvis close to where the prostate was located. But generally speaking, the prognosis after surgery for favourable intermediate risk and intermediate risk in general is quite good. After treatment for high risk prostate cancer, you're more likely to need additional treatment at some point in the future. And similarly, the same is true after radiotherapy. The outcomes are good in almost all cases. Sometimes with radiotherapy, you have to combine it with hormonal therapy. So for low-risk disease, with radiotherapy, if it's given, the chance of recurrence is very low. If you have high-risk disease, it needs to be combined with hormonal therapy for 2 years. Hormonal therapy means getting rid of the male hormone testosterone, and that can help to improve the prognosis after radiotherapy. After partial ablation or focal therapy by HIFU or similar energy forms or technologies, the prognosis is also good. Most people do not have a recurrence. The vast majority of men have just one treatment by focal therapy with HIFU. Some men might need a second treatment, but that second treatment is as well tolerated as the first treatment in most cases. And only a few people, well, very few people have another cancer in the prostate that needs additional treatment after focal therapy. And that is true after all treatments. We know that surgery has a recurrence rate, radiotherapy has a recurrence rate, so does partial ablation. They all have risk needing an at some point. But by and large, most men who have treatment by any of these modalities, if well selected, will do extremely well.